on ttalk Boond Soch powered by Dr. V. N. Brins Medical Institute of Management. Today on our show we are having Dr. Manjeet Singh Arora Sir. Welcome.
Thank you, sir. My pleasure.
Dr. Manjeet Singh Arora is a senior consultant general physician with Fortis Hospital for last 23 years, and we have covered various health related issues on our show. Sir, now in fact I could see a CPR man of India and CPR warrior.
Yes.
And apart from that, there are various awards in the recognition what I have seen. So what is this CPR man of India and the CPR warrior? Can you please elaborate for our target audience, please?
Definitely. CPR Warrior was awarded to me the title by the one and only one Suryakant Cheda with Ashwinji from Mulund, and CPR Man of India was awarded to me by Anubandha Institute of First Aid when I was a student on 25th of May at Fortis Hospital learning about CPR. What is this CPR? This is cardiopulmonary resuscitation done only to a cardiac arrest patient. That means the person who is dead within first 4 minutes as per the American Heart Association latest guidelines.
And sir, also when we talk in terms of an heart attack and cardiac arrest, like can you throw more light for our target audience?
So lovely. This is something very close to my heart, and that is how I have become the CPR Man of India. We are still not understanding, sir, what is heart attack and what is cardiac arrest, and there is something more which is called as stroke.
Mm-hmm.
Now the difference between heart attack and cardiac arrest is a very thin line. Have a look. What is heart attack? मेरे को दुखता है, मेरे को बहुत दुख रहा है, गया, मर गया मैं. This is heart attack. The heart attack patient, when he gets an acute chest pain, he is speaking, he is talking.
Mm-hmm.
But as far as cardiac arrest is concerned, have a look. I would like to demonstrate here. Imagine there is a flight come from Goa and the aero bridge goes there. Hundreds of passengers keep coming out, and suddenly one passenger collapses like this. This is cardiac arrest.
Mm-hmm.
Cardiac arrest does not give you time.
Mm-hmm.
So in simple language, to make it very easy for you, heart attack is blockage and cardiac arrest is electrical imbalance of the heart. So heart attack is flickering of the light and cardiac arrest is fuse off. That is how I can make you understand.
So can you demonstrate for target audience, like, if there's a cardiac arrest,
Yes.
then what they should do, like?
Lovely. I will just do this. Thank you very much. Now, as far as cardiac arrest is concerned, I must first know whether the patient is live or dead. I put my hands on the shoulders and I shout very close to his ears, "Are you okay? Are you okay?" 2 times I will shoot here. 3rd time I will look at the legs. Sometimes it so happens that the person is unable to speak, but he moves his foot. That means he is alive. If he is alive, he has not to be done the CPR. Then I just put him on the recovery position and I save him. However, if I say, "Are you okay? Are you okay?" and there is no response, I will check his carotid pulse. I will check his carotid pulse. No pulse, no response, then I am going to shout, "White shirt, call ambulance 108. I am starting CPR." How do I keep my palms, my hands on the CPR? Because for CPR, you have to be quick, hard and fast. Hold the palm like this, keep it just below the nipple here, and with your second palm, come here and start pumping. However, the level of the patient and the first aider should be same. Now, since we are doing live, I'm just trying to give you the live demo. American Heart Association guidelines is, to begin with, you have to have 120 compressions per minute. How many compressions? 120 compressions per minute. Looking at the face side of the casualty for a response. What will be the response? The twitching of the lower lip or the frowning of the upper eyebrow. The moment you have seen this response, you will immediately come to the head side, pinch the nose, keep the flat of your palm on the forehead, and with these 2 fingers, do this movement which is called as head tilt chin, and come and give 2 breaths. 1, take a normal breath, 2, and immediately come back. American Heart Association guidelines says the gap between the rescue breaths and the compression should not be more than 9 seconds. Should not be more than 9 seconds. Immediately I keep here. But now the cycle will be 30 compressions, 2 breaths, 30 compressions, 2 breaths. How long? In 1 minute, we breathe 12 to 15 times. So I will need to do this about 12 to 15 times per minute. 30 compressions, 2 breaths, 30 compressions, 2 breaths. If I have continued this, there is no response, I need to do this CPR half an hour or until the medical help arrives. Still, I am in a remote place, medical help has not arrived, there is no response from the casualty. What will I do? I will give the casualty a cardiac thump. I just close my fist like this with the thumb inside and give a cardiac thump just below the nipple. 1, looking there. 2, looking there. If there's a response, I will just do this. Put him in the recovery position on the right side and give him a pat on the back because the heart is here on the left side. He survives. However, in case if this be a female patient, what do? I will just pick up the breast tissue thoda sa upar and give this cardiac thump slanting at the base of the heart, which is the left ventricle. This is called cardiac thump. Let me go back to the first step. However, American Heart Association says that in case you are unable to give the breaths, you can begin the CPR by giving 2 cardiac thumps right in the beginning, because this may also induce 10 to 15 joules of the current. And it will help for you to continue the CPR, cardiopulmonary resuscitation. Friends, remember, heart attack, patient is alive, cardiac arrest, patient is dead. Post, when you have checked the carotid pulse, no response, call for the ambulance and start CPR. But remember, hands-on experience, hands-on CPR makes a difference because the person may survive. I'm not asking you for your thumb today like the eclair, our history. God has given you 2 hands. Put it properly, be quick and fast, and save a life. This is CPR, and that is how on 25th of May, when I completed this activity at one go, sorry, the team labeled me the CPR man of India. I had 22 friends with me. Nobody could complete the 120 competitions. I went in one stroke, and my teachers were thrilled. The name of my teachers is Dr. Pooja and Dr. Shruti, who labeled me CPR man of India, and I'm proud to be a student of that institute working at Fortis Hospitals. Friends, CPR can save a life. You have to be quick, hard and fast. So that's the difference, sir. This is what is called CPR. We can save a life.
Dr. Manjeet, excellent. I'm sure like the target audience are watching you. Now, they've seen the difference between the heart attack and the cardiac arrest which is there. And the demonstration, I think, was an act. I'm sure like it's any one of you, they see this kind of a symptom, they should go ahead and try and have this kind of a demonstration. Will save somebody's life.
I can just help you, sir. The heart is here on the 3rd button. 1, 2 and 3. This is the heart. Now why the 3rd button? Because as per the medical knowledge, the heart is where the sternum bone completes and in the center, the chest. So the moment you feel here, this place your heel of the palm, this is the heart.
Good, great, sir. I'm sure it's a great insights what you have given for our target audience. I'm sure like it's anyone who is going to watch our show will get very good insights as far as to save somebody's life. Thank you very much, Dr. Manjeet Singh Arora.
My pleasure.
Thank you very much. God bless you in abundance. Thank you.